Hi, my name is Dr. Carol Steiner. I'm a pediatric hospitalist for Children's Specialty Group and have been for 7 years. I'm also a practicing pediatrician in the local community and have been around for 12 years. I'm here today to talk with you about some frequent questions that parents ask about general baby care. While your baby is here, we'll be showing you some of these things, but here are some important pieces of information that you'll need to know when you take your baby home. When your baby goes home, there will be a small amount of the umbilical cord still left behind. You want to make sure that you are keeping that area clean while you change the diaper, and you can expect that the cord will fall off usually within 2 to 3 weeks. It should fall off, the base will still be moist, and we want you to continue to clean that area, and babies should not have immersion baths until 2 days after the cord falls off. If you have a baby boy and are choosing to have him circumcised while you're here, when you go home, his penis head will look very raw, sort of like the inside of your mouth. And as the days progress, it will begin to heal and develop a whitish or yellowish gray film over the head of the penis. Many parents get concerned because they think that this is infection, but actually it's just the new skin forming. And while it's doing that, we actually don't want you wiping it with diaper wipes. You can basically just clean the area with warm water and then go ahead and put a new diaper on. The area should heal within 10 to 14 days and look perfectly normal, and you can go back to using diaper wipes. We also recommend using Vaseline during this period of time. It won't help the penis head heal faster, but it provides comfort for your infant son by making sure that his penis head does not stick to the diaper. You can choose to either formula feed or breastfeed your baby. If you choose to breastfeed your baby, we have lactation consultants here in the hospital that would be happy to help you get things started and going. And if you have questions after you go home, you can still call here to the hospital to talk with them if you can't get in touch with a lactation consultant at your pediatrician's office. You can expect that when your baby goes home, they should be taking 1 to 2 ounces of formula every 3 to 4 hours, or if they're breastfeeding, they should be breastfeeding a minimum of 5 to 10 minutes per breast every 2 to 3 hours. We don't like babies to go longer than 4 hours without eating, even if you have to wake them up. We don't like them sleeping through the night till they're closer to 2 months old. Your baby should have at least 3 wet diapers every 24 hours and at least 1 poopy diaper. They can have lots more than this. There's not really an upper number that we get concerned about, but if it's less than this, that could be a sign that your baby is getting a little dehydrated and you want them to see your pediatrician. We like you to have a pediatrician picked out before you come because we like babies seen within 2 to 3 days of going home from the hospital. There are some instances though where we want you to take your baby in sooner. If your baby has any fever whatsoever, so that's 100.4 degrees Fahrenheit or greater, they need to be seen right away because babies' immune systems are very immature, and sometimes the only sign that they'll show of a fairly serious infection is a real low-grade fever. And so we want to make sure that you take them in and have them checked out. If your baby seems to be sleeping a lot and you're having to wake your baby up for a lot of feedings, that could be a sign that there's a problem and they should be seen. If your baby isn't eating, as I've mentioned previously, or if they're not peeing or pooping as much as I've mentioned, we definitely need to see them right away. I hope that all this information has answered some of the most frequently asked questions that parents have about baby care when you go home. Please feel free to ask us any questions while you're here in the hospital or to give us a call once you've gotten home. Congratulations, and we look forward to welcoming your newborn into the world.